A concerning trend is raising alarms in the medical community, driving awareness of a significant health risk for younger people: strokes. While the number of strokes in people ages 18 to 45 has been growing at a faster rate nationally than in any other age group for the past few decades, the number of young adults experiencing strokes in northern Colorado has nearly doubled over the past few years. This trend is alarming and calls for immediate attention and action. A startling increase. In 2020, about 5% of people who presented with a stroke at UHealth Poudre Valley Hospital in Fort Collins were between the ages of 18 to 45. By July 2023, that number had risen to 9%. Similar increases have been observed across all UC Health's Northern Region hospitals, including Medical Center of the Rockies, Longs Peak Hospital, and Greeley Hospital. "It's a terrifying trend," said Amanda Werner, UHealth's stroke program manager in Northern Colorado. Exploring the causes. This rapid increase in stroke cases among young adults begs the question, what is causing more young people to have strokes? The leading cause of long-term disabilities in the U.S.? Werner and her colleagues, including stroke program coordinator Melinda Tafoya, have not pinpointed an exact reason for the spike in cases in northern Colorado. However, many cases seem to be linked to unhealthy lifestyle choices such as poor diet, limited exercise, smoking, and overconsumption of alcohol. We used to see stroke in younger people mostly happening in those with a genetic predisposition to stroke, like having a blood clotting disorder. But now we are seeing how quickly poor lifestyle choices can affect the body and the overall risk for stroke in younger adults, Tafoya said. The role of lifestyle. Experts have long known that diet and lifestyle contribute significantly to cardiovascular health. Smoking, excessive drinking, obesity, high blood pressure, and high cholesterol are all risk factors for strokes and other cardiovascular diseases. These lifestyle choices and conditions can weaken or damage the arteries, causing clots to form. A stroke occurs if a clot blocks or ruptures the blood vessels carrying oxygen and nutrients to the brain. Ischemic strokes caused by a blocked vessel account for about 87% of all strokes and 60% in people under 50 in the United States. Although the majority of ischemic or hemorrhagic strokes happen to people over the age of 55, the increase in stroke occurrences in younger people has medical professionals heeding warnings that strokes are not just a concern for older adults. We definitely have seen an increase in poor lifestyle choices for younger people, like unhealthy eating, doing less exercise and activity, and being overweight, Tafoya said. Activities like using alcohol and drugs and smoking can also increase your risk for stroke, and these activities are often starting at younger ages. Statistical insights. According to the latest information from the Centers for Disease Control and Prevention, CDC, about 23% of people ages 18 to 39 have hypertension, which doubles a person's risk for stroke. Research also shows that in a classroom of 30 youth, ages 12 to 19, one person would have high blood pressure. At the same time, 3 would have elevated blood pressure. According to the CDC, youth with hypertension and prehypertension are much more likely to have these issues continue into adulthood. Medical community's response. Werner noted that the downward trend in the health of young people has resulted in an educational shift in stroke assessments within the medical community over the past decade. Before, if you were 24 and came to the emergency room thinking you were having a stroke, chances are they likely would not have considered that as an option, she said. As a whole, practitioners have changed their practice and are no longer dismissing strokes in people of younger ages. Providers, pre-hospital crews, and nursing now do an amazing job of picking up on stroke symptoms and act quickly when they see them in a patient. The impact of COVID-19. In recent years, COVID-19 has been added to the region's list of stroke risk factors. Since the pandemic, doctors have seen more patients with sticky blood, where blood thickens, causing abnormal blood clots. Experts believe it happens because of inflammation in the body when it is attacked by the COVID-19 virus. Not everyone who gets COVID has clots, but evidence shows an increase initially in the likelihood of a clot, said Dr. Jacob Chaco, a cardiologist at UC Health Heart and Vascular Clinic in northern Colorado. According to the American Heart Association, COVID-19 is linked to a sharp increased risk of blood clot-related issues such as heart attacks and strokes up to a year after a COVID-19 diagnosis compared to people who have never had the virus. Werner stressed that evidence suggests the coronavirus causes sticky blood, but there is no evidence to suggest COVID-19 vaccines contribute to this issue or increase your risk of stroke. Prevention tips. Preventing strokes involves addressing the risk factors associated with the condition. Here are some tips for reducing alcohol consumption. A significant lifestyle factor. 1. Track your intake, monitor your alcohol consumption, and identify ways to reduce it. 2. Alcohol-free days. Aim for 2-3 consecutive alcohol-free days each week. 3. Substitute drinks. Replace alcoholic beverages with low or no alcohol alternatives. 4. Smaller portions. Opt for smaller serving sizes like a small glass of wine or a half pint of beer. 5. Healthy relaxation. Find alternative methods to relax, such as exercise, which is a healthier way to manage stress. If you find yourself in situations where you might drink more than the recommended limit, you can reduce the short-term risks by setting and sticking to a limit on the total amount of alcohol you consume, drinking more slowly, drinking with food, alternating alcoholic drinks with water, recognizing stroke risk factors. Understanding why people have strokes is crucial for prevention. Here are some key risk factors. Hypertension. High blood pressure increases the heart's workload and damages arteries and organs over time. Obesity, a significant risk factor for cardiovascular diseases, including stroke. Smoking, increases blood pressure and reduces oxygen in the blood. Excessive alcohol consumption can lead to hypertension, atrial fibrillation, diabetes, obesity, and liver disease, all of which increase stroke risk. High cholesterol causes plaque buildup in the arteries. Gender. Strokes are more common in women than men, and women of all ages are likelier than men to die from a stroke. Pregnancy and birth control pills pose unique stroke risks for women. Ethnicity. The risk of having a first stroke is nearly twice as high for blacks as for whites. Pacific Islanders also have a higher stroke risk than other races. Increasing awareness and education. The stroke team in Northern Colorado continues to educate community members, both young and old, about stroke risks. We do a lot of education at community events, including visiting schools to teach about stroke prevention and identification, Tafoya said. Recognizing stroke signs. Recognizing the signs of a stroke is just as important as prevention because an untreated stroke can lead to rapid damage to brain tissue. Stroke is the leading cause of disability, Tafoya said. Strokes can cause minimal to severe deficits that require long-term therapies and even 24-hour skilled nursing care. Quick treatment is paramount because doctors cannot know how a stroke will affect any one person. For some people, if the vessels are happy and healthy, you can hang on for a while with collateral circulation, Werner said. Collateral circulation means blood travels to an alternate route, bypassing the larger blocked vessels, so the brain still gets some of the nutrients it needs to survive. This helps lessen brain damage caused by a lack of blood and oxygen. But we have no idea if someone's blood vessels will do that, Werner said. So for some, it could be several hours, but for others, brain tissue dies within seconds. Treating a stroke as quickly as possible increases the chances of preserving brain tissue and, in turn, lessens the patient's chance of suffering long-term deficits. If you're worried it's a stroke, call 911, Werner said. If you come by ambulance, it could shave valuable minutes off the time it takes for you to get treatment. You lose 1.9 million brain cells each minute that brain tissue doesn't get a blood flow, so every minute counts. The rising incidence of strokes among young adults is a concerning trend that requires immediate attention. By understanding the risk factors, making healthier lifestyle choices, and recognizing the signs of a stroke, we can work towards reducing the occurrence of this life-altering condition. The medical community continues to adapt and respond to this challenge, but awareness and education remain key in combating the rise in strokes among young people. Don't forget to subscribe to the channel, and comment below the video to support the channel's development and have more great topics. Thank you.